A very good evening to you all. Welcome to session 8 of Life and Homeopathy Through My Eyes. Today's topic is don't let your gut become a rut. Yes. Hippocrates, father of medicine, said all diseases begin in the gut. So true. Well, all the nutrients that our body needs enters our body through the gut. It is in the gut that the digestion and absorption of food happens. It is through the gut that the toxins and the waste are thrown out of the body. Well, 80 to 90% of our immunity is located in the gut, making it one of the vital systems of our body. It's so amazing how our body works, isn't it? Well, to know more about how our gut functions, what are the common ailments that one suffers from, and how one should take care of the gut and have a healthy gut, we have on our session today Dr. Manmohan Kamath, a gastroenterologist and a laparoscopic surgeon. Well, he has been the head of the general surgery and minimal invasive surgery department at Nanavati Super Speciality Hospital. He's been in this field for almost 30 years and has performed many complicated procedures of laparoscopic not only in India but abroad too, and has been appreciated, won accolades in India and by the international experts too. Well, let's call upon, without wasting much time, Dr. Manmohan Kamath on our session. Dr. Kamath, we are awaiting your request. Yes, Dr. Kamath, we cannot see you, but we are hoping that you can join us soon. Yes, okay, till we have, maybe there is some technical problems or error, till we have Dr. Kamath on our session, let me tell you a little bit about our gut. So our gut, our digestive system or our digestive tract, it starts from our mouth. That's the beginning of it, and it ends in the anus. It basically consists of the mouth, the food pipe, then you have it entering into the stomach. Then from the stomach you have the intestines that begin, that is the small intestine, followed by the large intestine, then the rectum, and last the anal opening, that is the anus. So friends, the digestive system that is there, every part of it has a lot of functions to do. In addition to this main system, the digestive system, there is something which adds upon to it. It is an accessory, that is the liver, the pancreas, the gallbladder that is there. Now, what happens is when we have our food, it is chewed in the mouth. It is with the help of the saliva that the breakdown happens. It's very important that we chew our food properly because this saliva, its presence helps us to taste the various food which are there. That is whether it is sweet, whether it is salty. Oh yes, we have Dr. Kamath. I think he is logging in from another account. Okay, let me see, let me accept. Yes.
Yeah, hi. Hi,
Good
Dr.
evening, Dr. Kamath. We
Good
were
evening,
waiting
good
for
evening.
you.
Sorry for this technical issues actually, you see.
No
So,
problem. How have you been?
yeah, I'm good. Good to see you. How are you doing?
All good, all good.
No.
So, may the viewers get the best of your presence here today. So let's go directly on the questions. Can we?
Yes, yes. Please, please.
Okay. So first and foremost, many patients complain of burning in the chest, or they say मुंह में खट्टा पानी आता है. So what exactly is this, and how does one take care? I usually find them popping antacids, or they are having cold milk to relieve it. What does one advise to them?
You see, this particular problem is something called as a reflux disease. Basically, what we call it in the medical term as gastroesophageal reflux disease. You see,
Right,
whenever we take food, the food is supposed to go into the stomach, and it's supposed to not come back from there. But what happens in some diseases, or maybe due to some type of wrong practices, the valve which is supposed to be present between the food pipe, that is esophagus, and the stomach becomes weak, and the acid, which is a natural production which is in the stomach, tends to reflux back into the esophagus, where patients experience a retrosternal burning, as we call it, or in the chest, the burning
right,
sensation, or as you said,
right,
khatta pani muh mein aata hai, this type of symptoms which they experience. So
right,
these patients are the one who suffer from these particular things, and mainly these are the things which are seen in patients who are having, some of those comorbidities. These are basically some type of muscular weaknesses what are seen in this patient. They have some wrong food habits, or some of the diseases underlying there in such things which are there.
right,
So many times you find this disease or this type of things which are present, who are lot of consumption of wrong food, such as maybe tea, coffee, or maybe nicotine, alcohol to that extent. So those are those patients where they experience this type of problems which are there.
right,
Then there are patients who tend to have a little wrong practices, in the form of a lot of patients have that tendency to burp in the morning. They put in their fingers in the mouth and try to bring out the things in the early morning, and a lot of people have that
right,
habit, and they have seen their parents doing that, so they have been doing that, of cleaning that stomach, this type of things which are there, which is not a good. It is unphysiological. Actually speaking, in the morning we
right,
try to bring out the acid. Even
right,
in yogic practices, they have been taught of something like washing the stomach. So people drink about 3-4 liters of water in the morning and vomit out all that thing. So these are all unphysiological things which are there, which should not be done, because whatever goes in your food pipe and into the stomach is supposed to go down and provide you nutrition. Unless
right,
it is toxic, it is irritant, it is not acceptable by stomach, then yes, there is a tendency for a patient to vomit out. But if you do such type of things, they eventually lead to weakening of this valve which is present between the food pipe and stomach. And these are the
right,
people who will experience in the later period of life about this reflux disease, which is there, which is, as we rightly said, about burning in the
correct,
chest, or khatta pani muh mein aata hai. And many times with a gravity plays a role. So when they lie down in the bed, these are the things which are experienced much to them when the stomach is full.
right,
So these things are, a part and parcel of such type of problems which are there.
right. So what do you advise them?
Well, the advice is basically to understand why this is caused to them. That is very important. So
Correct.
one must understand that why these problems are there. So if you are taking any excess irritants in the form of, as I told you, tobacco, alcohol, excess tea,
Okay.
coffee for that matter,
Right.
even spicy food, or too much of a food at times,
Right.
I mean, the stomach full, you eat a lot of food there at times. So this is to be
So,
avoided actually, all these things.
right.
Even obesity for that matter plays a big role in such type
Correct.
of things. So that
Right.
has to be, correction of the lifestyle is very important. Second thing
Right.
is that one should not lie down after having food. They should
Correct.
already, in our this thing, what we call it as a Shatpauli. So you are supposed to take 100 steps at least before, after the food, so as to digest it well, for it to go down well. So all those things are required, in such things, which people, if they don't do that, they just lie down immediately after food. These are the people again who are more prone
Right.
for such type of
Correct.
practices. So,
So, in
we
short,
should avoid those things.
major important role that is the lifestyle changes that one needs to do. Right?
Absolutely, absolutely. Yes,
Right.
very
So,
true.
well, viewers, Why suffer from acid reflux? It can cause cough, it can cause hoarseness of voice, it increases because of the acid coming up. But as Dr. Kamath has rightly said, we need to make the changes in our eating habits and change our sedentary habits which are there. Reduce on tea, coffee, alcohol, nicotine, and so on. Also, many a times, I think even citrus foods and citrus juices, when you're already having a reflux problem and you have it, it could aggravate that problem, right, Dr. Kamath?
Yeah, yeah. It
Yes.
irritates the stomach to some extent, and that causes
Correct.
contraction, and weakened valve allows it to reflux it back into the
Bring
chest
it back.
and throat.
Correct. Right. So going ahead, Dr. Kamath, stomach ulcers, do they present similarly like an acid reflux, or how are they different?
No, no. See, these two are the completely different diseases. Remember that reflux is something which is because of the weakening of the valve which is present between the food pipe and stomach, as against ulcers, which we generally refer in the medical term as a peptic ulcers. They
Right.
are caused due to two reasons. One is increased acid production, or two is the defense mechanism to prevent that acid from causing the harm to stomach. If that is affected, then you will have these problems coming up. For example, the increased acid production could be the similar cause for what we just described is about the wrong food habits, or keeping even the stomach empty for a long time also can result into such type of problems. And this
Right.
increased acid secretion have burning sensation in the upper chest. It may or may not be associated with reflux. The ulcers can be either in the stomach or they can be in the first part of the duodenum. These are the two places where these ulcers can be caused. And ulcer in a simple layman's term is nothing else but a wound which is present on the stomach, or the lining which is present in the stomach. Now, this
True.
particular part of your stomach has a defense mechanism in the form of some of the mucus or secretions in the stomach have a layer formed inside the stomach. It's like a velvet layer which is protecting your stomach wall. So, if there
Right.
is the breach, or if it is less secreted, or if it is damaged, then the acid will penetrate in there and cause a wound there. And
Right.
that wound will give rise to pain. So whenever you eat, if there is a stomach ulcer, it will give pain. Or whenever it is duodenal ulcer, which is little beyond, or the first part of the small intestine which is there. So when the food
Right.
goes down from the stomach, that time it gives pain. So pain
Right.
durations can vary in stomach or duodenal ulcers, though the pathology in both these cases, that is stomach or peptic ulcer as we call it, is the similar pathology which is there. So the treatment modality also is a similar modality
Right.
in such things
Well,
which are there.
can stress cause ulcers?
Definitely, definitely. See, just to give you a very small example about that, most of us have gone through the difficult times. Or why difficult times? Most of us have given some exams for your studies whenever you are appearing for. And what happens? The commonest thing what one experiences many times, or many of the people experience, is the
Right.
mouth ulcers. What you get? You get a small ulcers, like whenever you eat any spicy food, it gives us a lot of burning there. Same thing
Correct.
where when it causes into the stomach, it will be called as, you can get a glimpse of that. Now,
Right.
whenever you are subjected to stress, these are the
Right.
things which get, precipitated in that. Your eating habits, for example, you are awake in the night, you don't get a proper sleep, you are stressed, or even for that matter, if you take some medication for suppose for your backache or whatever, I mean, whatever the pains or fever
Painkillers.
or whatever,
Right.
all these medicines which you are commonly or usually available over the counter, if you take it, they also can result into ulceration of this defense layer which is present in the stomach, and the
Correct.
normal ulcer will cause a normal acid will result into the ulcer formation in such
Right.
circumstances. So that is what is seen in
Stress
some
related.
cases.
Yes. Okay. So very well explained, Dr. Kamath. So in short, viewers, we know that we need to handle our stress, either prioritize our work, or we need to do little things to keep us happy, because the serotonin, the feel good hormone, is also released by our gut. And that's where I said most of our immunity lies in the gut. So taking
Yeah,
care of
protection of the
stress.
gut is very important. Protection, and
Right.
second thing is one must before we go on to the other thing, I must warn our viewers about that. Many times there are yogic practices what they see, that is to be avoided because these are the advanced yogic practices what are been done. You see someone doing that or vomiting out in the morning and then they feel it's like a washing up our stomach area. So these are the things which you cannot do it offbeat. You have to follow a certain diet, certain protocol, certain disciplines from the yogic point of view. Try to become a yogi in totality rather than taking half-heartedly some steps which are extreme and then expecting a miracle out of that. That doesn't happen. So you have to
Right.
very cautiously take those things into account.
Right. So if you're following the yogic practices, follow them completely, even where the food is concerned, what you consume, how you eat them, the interval and everything, and then you could practice it. You might be thinking, viewers, my thoughts are in the mind, but the ulcer is in the stomach. How can it happen? Well, mind and body both are connected and have an impact on each other. And that's
Yeah, yeah.
how the acid secretion increases and causes the ulcers. That's what
Yes, it's
Dr.
a
Kamath
single
just
machine which is
explained
there.
to us.
It's a
Yes.
single machine. Mind,
Right.
body, everything works in the same way. Mind, brain, body, everything works in the same way. So you have to treat, you can't isolate them and treat single part and then try to be happy about it. It doesn't
Right.
happen that way.
Many people consume probiotics available. So, what do you advise about this availability and consumption
Uh,
of probiotics?
See, let me tell you now about the probiotics or prebiotics, as one may call it, all these things is nothing else but they are, though they are available, though they are available at a chemist shop or your pharmacy, these are actually not medicines per se. Okay. Now, what are they? They are basically nothing else but a type of food, or rather the organisms which are lying in your own gut. Now remember, we live here in symbiosis with the environment. Nowadays, as you have been experiencing that suddenly one virus becomes dominant, and you see how we are getting troubled because of that.
Right.
But remember that there are so many viruses, there are so many bacteria which are lining all throughout your gut. Your gut is harboring so many bacteria, and there are many of them are good. They live, they let live. So you thrive with that. Best example to understand it better is the curd. When we put in a milk and a little bit of this thing, what happens is that the milk gets converted into curd. How does it? The lactobacilli, which are there? They
Right.
are the organisms which are there, beneficial for the body. So they
Correct.
work with a symbiosis. We consume that. They are the good harboring one which are helping us. So buttermilk, curd, good for
Correct.
digestive purposes because they contain the good bacteria. Once the
Right.
domination of the bad bacteria or the bad organisms in the gut becomes very dominates the one, then the diseases start. Your guts goes for a toss. So in such
Right.
cases, to give the external aid to these organisms which are there, what is done is these pre-probiotics which are there, they come into place. So this is nothing else but a concentrated good organisms which will help you for a betterment of your gut. That's it.
Right.
That's the way
Good.
it works. So
Right.
they are not medicines as such, or just the good bacteria which are supposed to help us in
Correct.
those forms which are there.
Right. So, viewers, our culture of having chas, buttermilk, or curd actually helps our bacterial culture in the gut too. And let me tell you, there are 100 trillion bacteria in our body and 1,000 varieties of it, most of which are beneficial. One question to you, viewers, for fun. Our brain weighs 3 pounds and the bacteria all put together weigh 3.5 pounds. Is this true? Message me. Well, going ahead, Dr. Kamath, a very vital question. Uh, how will one differentiate pain in the chest arising out of stomach ailments and that from cardiac or heart ailments? How does one differentiate and when does one really panic?
Let me tell you very interesting statistics. You see, if you tend to travel into so-called intensive care units or intensive cardiac care units of many of the small establishments, for sure, small nursing homes, what I mean establishment is the healthcare providers, you will find that many of those patients who are admitted there, the diagnosis at the end of the investigation turns out to be a reflux disease. So what is so closely, all their uh, all their presentations or symptoms what are there of these patients are extremely similar. I mean, there is hardly any difference about to differentiate. But then, how do you differentiate? It's a good question because finally one is worried about the cardiac element rather than the stomach elements can be definitely treated with. One cannot be so scared about. But if it is a heart attack,
Correct.
zindagi na
Yes.
mile dobara. So, you have to be very careful about that aspects about treatment of the
True.
cardiac element. So
Right.
one should identify which are the vulnerable groups here. Okay. So every patient who complains about the chest burning, rushing to the hospital, getting admitted and getting angio done, certainly not. I mean, don't think that we should do such type of issues or problem create about it. So one must identify the vulnerable. Who are these vulnerable groups? Vulnerable groups are the ones who are extremely stressed, who have comorbidities in the form of uncontrolled blood pressure, uncontrolled diabetes, a known
Right.
cardiac patient which is there with a cardiac chest complaints, or maybe a strong family history of a cardiac disease. These are the
Correct.
patients who should, or maybe morbid obesity. All these patients are vulnerable. They are high risk group patients, as one may call it. Now,
Correct.
these are the patients who should always go and get investigated and try to understand what they should be doing or rather ruling out the things. Because sometimes it is better to get scared than not getting scared. Sometimes better to get investigated and know that yes, I am not suffering from a cardiac disease in order to be sure about that. And then yes, the
Right.
gut problems may be required to be treated in a proper way, depending on
Correct.
whatever the extent and severity of the conditions which is there. Even for that matter, gallstones, cholecystitis, or maybe some of the liver issues, they can also have a similar presentation. So all these upper abdomen and the lower chest are very very closely connected things with a containing a lot of important organs in the body: pancreas, liver, stomach, spleen,
Right.
heart. So all these are located in this region only. So
Right.
anything getting affected in some way or the other, the symptoms tend to be: first is a pain which troubles you the most, and then you are worried about it. So it better get
Right.
investigated. It's such type, especially the vulnerable patients who are there. They must get investigated for that because it's become
Right.
difficult otherwise to differentiate between the problems which you are facing.
Right. So true. So in short, what you would say, Dr. Kamath, better be safe than sorry.
Yes,
Yes.
yes, very true, very true.
Yes. And we better take care of our health through lifestyle changes, eating habits, and avoid sedentary lifestyles. That
Yeah,
comes
yeah.
to the basic need that is there
Prevention
for
is
a
better than
healthy.
cure is the gold standard, statement which is in the medical field. Prevention is better than cure. So,
Yes.
don't fall into the trap before
Correct.
then run for
True.
curing the whole thing.
True. So going to the next question, Dr. Kamath, many people, for whatever complaint they have related to the digestive tract, they say, मुझे indigestion होता है. Whether they have burning in the chest or they have gases, for everything, they say, मुझे indigestion है. What exactly is indigestion?
Uh, See, indigestion is a very general layman term. Okay. Now, for indigestion, people who have a gassy feel, people who are burbing it out, gases, or people who have, okay, some people have the problem of a little bit of bloating that my food, whatever I intake, I take it, I feel as if it is just sitting in the stomach and it is not moving further ahead. Some people say
Right.
that I am constipation is there, so I feel very full. Some people say my appetite has gone down. So, all these,
True.
or maybe even loose motion. Some people have this loose motion, they will call it a indigestion in the form. Now,
Right.
all these particular category of symptoms falls into a one group of what is called as indigestion. So, for not having proper digestion would be termed as indigestion in a layman's language. However,
True.
the presentation of indigestion, if you ask them about what exactly you mean by indigestion, because many people have that, their diagnosis is reached by themselves. So it's a layman's term, indigestion. It's not a disease per se. So
True.
it can be just, as I told you, a bit of feeling gassy, excessive burping, or little disturbance in the stomach, right from burning, or the symptom which we just explained about the peptic ulcer, the symptom which we explained about the reflux disease, to that
Right.
of the large bowel symptoms as well as we just discussed about the constipation.
Right.
All those things fall into the category of indigestion. So
Right.
having a food which is not suitable, sometimes people have that allergic component which is there. The food allergy, as we call it, some people have that food allergy, certain type of food they are allergic to. So even if they ingest that, they suddenly start getting abdominal cramps, abdominal
Correct.
pain, and then they again will come, doctor, I have indigestion. So it's better to get clarity about what exactly the patient tries to
Correct.
mean, meaning by that indigestion, and then the diagnosis or the
Accordingly.
treatment will vary accordingly.
Right. So right from the mouth, be it the change in the taste or be it the gases that one feels or the burning that one feels, that commonly is what that they term it as indigestion. And based on that, we take care related to it. Right? Okay. Going to the next question. People complain very often of having constipation, even if they pass motions or stool 2 to 3 times a day. So what exactly is constipation and how does one take care of this?
See, the happiest person, if you ask me, is the one who gets appetite and eats regularly and has the clear motions in a day. You will see that that person is happy. And why that? I mean, even on media, you will see so many advertisements coming about life is okay, day is okay, if motions are okay. That type of advertisements keep propping up on the media as well. Now, why
Right,
it is like that? The people, what they mean by, again, constipation is something which is. Let me first tell you about the medical aspects about the constipation part of it. Then we go to the
right,
people and layman's language about what they understand about the constipation. Now,
right,
remember is that as we eat every day, isn't it? A food at a certain intervals or whatever. Similarly, we are supposed to clear the gut every day. Okay, that is what is supposed to be done. So every day one is supposed to. Now there may be some amount of variation in that, and that is actually depends, or rather, how one trains the body.
right,
So, it's like one fine day you start exercise, your body is going to get pain. So, similarly, you train your body right from the childhood. So, you will find a lot of variation in this patient or the people about how do they pass stools. So, some people will have a habit of going 2 times, 3 times in a day. Some people will
right,
have a habit of once going in 2 days or 3 days, but they are not uncomfortable because of there is the tummy is okay. If you ask them, they say, nah, that is I've been doing for years. Whether from childhood I do that. So they
correct,
are not uncomfortable with that, not passing stools every day or
right,
passing it couple of times every day. That is a habit. But what
right,
happens? Why do they come up for a medical advice? Is because there is a disturbance in their routine practices. What happens is that they suddenly start feeling full, or even if you ask them constipation person, the person may say that I have not gone to pass stools for 4 or 5 days. That may fall into the category of constipation if he has the habit of going for once in 2 days. Or if you ask a person will say, I go, I've been going to the toilet every now and then, little bit passes, but still I'm not satisfied. Unsatisfactory passing of stools is a major thing which is there. So you're not satisfied by passing stools. You feel that something is remaining, I am uncomfortable with that. And that a particular category people generally tend to put it into the category of
constipation,
constipation. So that is
right,
what again they call it into that.
correct.
But these are the different variations which we see in these patients about such type of things.
Right. So it could be infrequent stools, which would be less than 3 in a week, or it could be hard, it could be difficult, it could be unsatisfactory. This is all, it could be hard, it could be dry. That is what all comprises of constipation. Yes, Dr.
For a
Kamath,
layman's
that's what
language,
it is. Yes,
constipation, yes, yes, they
yes,
do.
yes. So, but naturally, more water intake, that would you would advise more
Yeah,
fibers
yeah.
should
Food
be.
is the first. Safe. Always
Yes,
treat the diseases with
correct.
available resources. And what is
Right.
available resources for a gut? It is nothing else but the food. So if
Yes,
you want to have the satisfactory food, which is stool is passing, which is there, what is important is the bulk of the stool. What satisfies the person of having that sensation that yes, I pass stools. Now, how the
correct.
bulk will get created by increasing the fiber diet in that. So green leafy vegetables, fruits, even water intake for that matter, as you rightly said about it.
Correct.
These are the things which are useful in formation of a bulk. These are the bulk laxatives. They
Right.
remain inside the bulk, they form the bulk of the stool. Some of the commonly available preparations also which are there, for example, isabgula. What it does, it's a bulk laxative. It remains inside, it doesn't get absorbed, but it absorbs water at the time, it swells. And then
Right.
whenever it is passing, it forms a bulk. So the patient gets a satisfaction that yes, I have passed stools today. So isabgol also becomes some kind of dietary, adjuvant which can help in passing stools and at times becoming
True.
satisfaction of passing stools happens with
Right.
that.
Right.
So this is the
Right.
thing. So dietary modification is something very important that one must follow and do it. You
Correct.
see.
Yes. So well explained, Dr. Kamath. And there are so many problems related to the gut, but it is difficult for us to complete everything. We know that constipation itself could cause a lot of problems. It itself makes you feel lethargic, irritable, and you do not feel like doing anything. And it can lead to complications like piles and fissures too.
True,
Yes,
true,
but
very true.
yes. So maybe we could
Stools
take
can become
one more
hard if they
session.
remain
Yes,
in for a long time. What happens is the stool become very hard. And to
right,
pass those hard stool, one strains. Once you strain, that will result into piles. Hard stools
right,
while passing cause a wound at the anal end, what is called as a fissure.
right.
Increased pressure inside the colon will result into other diseases such as a diverticuli or things like that. So these are the things which can result by
Yes,
constipation per se. For a
right,
long-standing constipation should be avoided by correction in in a dietary manner, if not with some medication which are easily
correct.
can be used for such
True.
things.
Even abuse of laxatives probably could lead to constipation, and one must take care of that too, right? Yes. So,
One single usage of laxative will result into addiction or abuse of laxatives. You will get
right,
addicted to that. So all
correct,
these churns which are available or Ayurvedic preparations or for that matter even allopathic preparations which are available, they
right,
can result into addiction for taking them on a regular basis because unless and until you take it, you will not be able to pass stools in a proper manner. So try and avoid as much as possible if
true,
must due to whatever reasons because sometimes
right,
long-standing diseases causes a weakening of the bowel gut muscles and then the passage of the stool can get affected at times so
right,
those cases they do require sometimes the medical help.
right. So very well put, Dr. Kamath. And talking to you is never enough because one gets to learn a lot, not only related to the subject, but also gets to learn about how well a person as busy as him can balance work and
No,
life.
gut is at 22 meters, so the topic is also as long as that 22 meters. No, so every
True,
meter
true.
we can talk for hours. So it is
Yes,
like that. No? It's a very
yes,
long and a
we
long
will
topic to
need
talk about.
more sessions, yes, related to that. But I would like to tell about Dr. Kamath. The way he manages work-life balance is something to learn from him. He's one person who not only works hard but parties harder. And when I say parties harder, I mean he fulfills all his other passions, his hobbies to the fullest, be it trekking, traveling, writing short stories, poems, and even performing lead roles in plays for social awareness conducted by the medical fraternity. Thank you, Dr. Kamath, so much for taking out time to come on our session today.
Thank you, Dr. Prabha. I mean, it had been an excellent listening. I've been watching some of your programs, and as you said about the social awareness, I think these are definitely some of those type of social awareness, medical things which are
Right.
for the people that what you are doing. So, hats off to you that you take out time and conduct such program. It was wonderful to be there on show, and I think we'll
Thank you
discuss some
so
of the
much.
other parts of the gut some other time, maybe in future.
Yes,
Right?
yes.
Wonderful,
Thank you.
wonderful being with you. Continue the good work. Thank you so
Thank
much.
you so much. Thank you. So, well, viewers, remember, it's very important to have a healthy gut, because a healthy gut is a healthy you. We may not always be able to control what happens in our life, but we can at least control what we put into our gut and make it healthy, isn't it? So, friends, don't forget to follow us, like, and subscribe to our social media handles, be it Facebook, Instagram, or YouTube, and share the wonderful knowledge imparted to us today by Dr. Kamat. Have a great
Thank you.
weekend, great evening. See you next week, same day, same time. That is on 15th August, and have freedom from diseases. Thank you so much, Dr. Kamat. Thank you, viewers,
Thank you.
for viewing us today. See you again. Thank you. Bye bye.
Bye.